Well, last night I had the pleasure of emceeing a reception highlighting pro-life healthcare. The event, sponsored by Solidarity Health Share, honored healthcare providers who offer innovative solutions. The keynote speaker says the pro-life movement is backed by science.
To be pro-life is to be pro-science. The science of embryology has established that from the very moment of conception, we are unique, distinct, living, and whole human beings.
Dr. Peter Morrow joins us now. He's a practicing physician and president of the Catholic Medical Association. That's an organization of healthcare professionals. Welcome to the program.
Thank you, Lauren.
You did a great job last night, by the way. Let's talk about that science behind all of this. We've seen all of the wonderful emotion pouring out from everybody. We heard President Trump's speech. We heard the Vice President, Paul Ryan, was there. But the science is where we get tripped up on our differences.
Yes.
Tell us, when can babies feel pain? And there's a whole branch devoted to this kind of study. Let's talk about that.
You know, Lauren, to be pro-life is to be pro-science. And, you know, from conception to birth, there's a natural development. At about 20 weeks, there is a lot of data that shows that the nervous system is developed enough that they can not only feel pain, but joy. So, you know, to ban abortions at that point really makes perfect medical sense.
Yesterday, we talked about this. The HHS actually opened a new division for conscience protection rights that helps doctors and nurses who do not want to participate in abortions. How is this going to impact Catholic medical professionals?
We're very thankful that now there is some conscience protection for healthcare workers and physicians, because without conscience protection, we really only have two choices: either leave the practice of medicine or, you know, alter your conscience. And neither one of those suggestions are possible. So we're very thankful that now we have an opportunity to hear our voice heard if we have any impingement on our conscience.
When they announced that yesterday, they said that just in the last year alone, there have been 34 conscience protection people who are coming up and saying, I need protection from having to do this. And that there were 10 in the last decade, which I find remarkable. It's an issue that keeps moving forward. Do you hear from those doctors and nurses? Tell me about that.
You do. There are several physicians and nurse practitioners that are given options of either leaving or, you know, compromising their conscience. Fortunately, we work with legal firms that can help defend that, and we have filed many amicus briefs with the court protecting conscience protection.
What's your advice for them?
Hang in there.
Okay, hang in there.
Help is coming.
The cavalry's on its way?
Help is coming. But even despite this help, Lauren, the evil is still out there. Evil that seeks, you know, to eclipse the sense of God in the practice of medicine. This is wonderful, but we still have to keep going forward.
Thank you so much, Dr. Peter Morrow from the Catholic Medical Association.
Thank you, Lauren.